Hello world, my name is Kieran. I'm a student at UNC Chapel Hill, located in Chapel Hill, North Carolina, USA. Today is December 31st, and the title of my project is Quantifying Preclinical Investment Potential for Pharmaceutical Molecules. So I'm a pharmacy student, so I wanted to create a project that could be applicable to my work. I work for a company called Eshelman Innovations, kind of bridges the preclinical drug discovery occurring in UNC to the clinical trials and post-market surveillance occurring in Research Triangle Park with pharmaceutical industry companies such as Lilly or Novartis. So we're really a bridge between uh, like the drug discovery in the lab and then the clinical trials. So we're able to predict preclinical investment potential by several factors. The market, the drug, the disease, and how many patients it can impact. And we're able to pull that data from this site called Global Data, which has all the information about preclinical and marketed drugs. I created a code that takes these factors into account and gives us a score of 0 to 100 of the preclinical investment potential. And it's broken down into different subsections. But I've extracted the data from Global Data into Excel to kind of help expedite the process of showing the model. So we're going to use this drug right here, an injectable biologic for obesity with LEAP2 target. So we're going to say that's LEAP2. The name is LEAP2. Its disease is going to be obesity. The drug target is going to be LEAP2. It's going to be a biologic. It's going to be an injectable. Then we get what is the market space for obesity of 2024? Here we have 14 billion for obesity with an annual growth rate of 31.3%. Put a percent sign there. We could put the percent sign or we cannot. Our code kind of counts it just for the calculation. We don't want the percent sign, but we're able to code and replace the percent with a space to kind of negate that percent side. But obesity has a score for 100 for the market. It's one of the most prevalent diseases. That makes sense. How many preclinical molecules already exist for LEAP2 target? Well, it's a novel target, so there's going to be no molecules in the preclinical space. So none in phase 1, 2, phase 3, and none on the market. It's a novel target. So we got a novelty score for 100. And based on putting in an injectable, we get a route of administration score of 85. So from global data, we're able to extract that there are 0 gene therapies for obesity, 8 biologics for obesity, 336 small molecules, 336 oral, 8 injectable, and 1 other. Now we're asking how many molecules are in the preclinical space for obesity? A really pop-in market right now. But we have 292 preclinical molecules, 89 phase 1, 54 phase 2, 17 phase 3, 344 already on the market. And it gives us a drug pipeline score of 50.5. So disease prevalence takes into account how prevalent the disease is. So a super prevalent disease, obesity is BMI over 30. So we're going to say here we have 0.088235. Is obesity chronic or acute? It's chronic. Gives us a disease prevalence of 44.12. Target population takes into account the median age of onset. What is the median age of onset? There's some further market research, but we discovered that to be 39. And this gives us a breakdown of all the scores we have here. And a total score for the LEAP2 molecule of 65.17, which we can use to compare to other molecules to determine what molecules Eshelman Innovation wants to put its resources into. Thank you for your time.